you know you make me float, float. Boy, you really give me high. Ooh, I feel like I'm on dope, dope. 'Cause you.
Morning. Today is Wednesday, 26th of February. I am back here for my appointment with the nuclear medicine physician to do a bone scan. So there is no network. My appointment is at 9. Now the time is 10 past 8, and there is no network. I don't know. This area always doesn't have network, telecom network to be specific. So because I'm here earlier, I'm gonna go and chill by the hospital coffee shop and then use their Wi-Fi until maybe 8:30. Then I will go to the doctor. My network is a problem this side, so I'm here for that. Tomorrow I'm coming back again for a CT scan. So I don't even know if I'm going to do my best camera for proper quality. And yeah, I'll see. It's not the COVID.
I watch you as you drive. Do you know I'm looking? And I can't help but smile. Do you know how much I love you? You put my favorite song on, I put my feet up, and we just sing along. And I can't help but feeling, just loving this.
So the time now, it is 8:40. So I'm going to the doctor now for my appointment. My appointment is 9 o'clock, so I'm going there now. Yeah, we'll see what happens. The noise, there's no electricity. There hasn't been electricity here for like 5 days, if not 6, since Friday. They say since Friday they haven't had electricity. My friend stays around here, so she says that they haven't had electricity since Friday. It's a problem. It's a huge problem. So I bought this liquid fruit so that I can take my medication, painkillers. I didn't take my painkillers because I didn't have time to eat when I left the house. So I hope this is not going to be a problem. But then they didn't tell me if I shouldn't have anything to eat. So
I watch you as you drive. Do you know I'm looking? And I can't help but smile. Do you know how much I love you? You put my favorite song on, I put my feet up, and we just sing along. And I can't help but feeling, just loving this moment. Can we stay here forever? I'm loving this moment. Can we stay here together? If I could stop the time, don't you know that I would? 'Cause I'm
so the time is 9:15, 9:15. I just got a shot, an injection from the nuclear doctor there. Magagola, like people, they don't explain. She didn't tell me that I will have to go and then come back, because now you come and get an injection I got an injection from her, and then the next thing she's like to me, the next thing she says to me that it's fine, you can go, I'll see you at 12. That's not what she said to me on Monday. Now I don't know where to go, I don't know where to sit, because unkubile it's fine, you can go, I'll see you at 12. But yo, she doesn't have electricity, hana battery, I can't get hold of her, because I was gonna go and chill there by her place. Now I'm just gonna dry here. I don't even know. I'm gonna sit by the waiting area in the hospital because there's no way. It's cold, it's chilly outside, so I can't sit here. So I'm gonna go to the waiting area in the hospital. I guess I could job when you go there, they want you to buy. That's why I ended up buying, but they want you to buy. So then you go to the waiting area.
I watch you as you drive. Do you know I'm looking? And I can't help but smile. Do you know how much I love you? You put my favorite song on, I put my feet up, and we just sing along. And I can't help but feeling, just loving this moment. Can we stay here forever?
A few moments later.
Welcome to the vlog. Welcome to the new vlog. My name is Kwena Malamela, and I have been diagnosed with breast cancer, inflammatory breast cancer, which is positive to the hormones. It is caused by hormones. The main cause of it is hormones. So today it is Wednesday the 26th of February. I am from the nuclear medicine physician. I'm from there, and then I'm from there to do a bone scan, because the doctor required a bone scan because of on Monday, on Monday, when we were doing the consultation, he asked a few questions, and then one of the questions was that, do I have a history of cancer in my family, which I do. My grandmother, my maternal grandmother, she had arthritis all her life, just like my mom. And then on her last days, a few months before she died, she was diagnosed with cancer. I don't know which one, I forgot, it's been years. She was diagnosed with cancer, but then the cancer was related to her bones. So now, because since December, because remember December retail, we don't get a lot of off days, I have been working a lot, and then I've been struggling with back pain, and then my left arm, it's always painful. Even the right one, when it started to get painful, the right arm was always painful. So I thought even my left arm being painful, it was because of the lump that has developed in my left breast. So now the doctor required me to get the bone scan, and also he required me to do a CT scan. So tomorrow I'm going to do a CT scan. Tomorrow will be Thursday. I'm going to do a CT scan, and then they said that today's results are going to be available on Friday. So I think I will see the oncologist next week. Either he's going to get the results on Friday, maybe he will book me for an appointment for next week to discuss further treatment. So now they say that I must do the CT scan to do an X-ray. CT scan is an X-ray of the whole body, and then the same applies to the scan that I did, the bone scan that I did, to check if ever the cancer hasn't traveled to the bones and the rest of the body. because I did an ultrasound of the organs, but then he says that that's not enough to determine which treatment is best, you know, because he said that he wants me to start with chemo in a form of tablets that I'm gonna take orally, so that I can start shrinking the breast, this one, because it has expanded. It's like I've got an implant here. So he said that he wants me to do to shrink the size of the breast so that it can be like normal, like this one, and then I will be able to have the operation after. But then if ever it needs me to do like that chemo, the breast, the tube here, for the drip, then we'll have to do that. But then the operation will happen after. He said that we will only cut off this one, and then this one we will remove the lump, and then this side I will have to get a plastic surgery to reconstruct this breast so that it goes back to normal, you understand? So that is what's happening currently. I don't even know if ever my medical aid is gonna pay for those plastic surgeries, and Mina, I just wanted this breast off because I can't live with the pain anymore. The more future breast that I want, they are not going to be for me. So yeah, that's about it. That's the update. My friend is back. I was waiting for my friend, so she's back.
The next day.
It helps the speaker lead his audience into the scene he describes.
A few moments later.
Good evening, good evening. How are you guys? Oh, today I don't have energy. I'm tired, and also I'm not feeling well. So I don't know if ever I should just introduce the vlog, or I'll use yesterday's introduction to the vlog, or let me just introduce myself again. Anyway, welcome to the vlog. My name is Kwena. Um, my name is Kwena Manamela, and if it's your first time here, welcome, welcome, welcome. Here we talk about breast health because I've decided that I want to make an awareness. I've decided that I want to make an awareness with regards to breast health and breast cancer, and everything related, you know, the journey to diagnosis and the journey to recover. Because even myself, I didn't know what channels to open, to go to, which doors to knock on. So I hope that this can somehow help someone, you know, even though my dad is against it. But I feel like myself, I feel like it's the right thing to do. You understand? So I feel like it's the right thing to do. So so this week I've already posted about Monday I had an appointment with the oncologist. My first appointment. Kana ba re ke mang that doctor? Ba re ke Prayesh Gavan Shiva ke le India. So I had an appointment with him. He works for ABJ Oncology. So it's a center around here where they treat cancer. It's outside of Mediclinic. It's not inside Mediclinic. It's just outside, like the next street, you know. So I saw him on Monday. He then referred me to the nuclear medicine physician for the bone scan, which I did yesterday, and then he also referred me back to the radiology for what is this, for the CT scan. But then here it says CT base of skull to symphysis pubis plus count, and then I wanted the number. So that's basically the test that I did today. So that test is to check my organs, because I did an ultrasound. Remember, I did an ultrasound in one of my videos beginning of this month, which I was referred to by the surgeon. So I did the ultrasound. The ultrasound said that I've got an ectopic kidney, meaning that if kidneys are supposed to be like this, mine, I think it was the right one, it's like there at the bottom. They are not aligned like this. It's there at the bottom. So even today, the guy that was assessing me, he picked it up and then he asked me, when was the last operation you had in your stomach? I'm like, operation in my stomach? You know, I've never had an operation in my stomach. The only operation I did was when I was almost the same age as my girl, 7, 8. It was an operation to remove my tonsils. So that is why now I don't suffer from tonsils. I don't suffer from sore throat. If I have sore throat, it would be like it will just be like 2 to 3 days that week when I'm catching a flu. So and I don't suffer from tonsils because I removed my tonsils when I was in grade 2. So what happened today's test, what they did was, I arrived there around 8:25 to 9. My appointment was for 9 o'clock, and then I got there. They gave me 2 bottles. I will post the bottles just after. They gave me 2 bottles of a solution inside. It's a medicine that I was taking every 30 minutes from 9 o'clock until 11:30. So that medicine, sorry about that. I wanted to check if ever this phone is recording because I'm using the back camera. Again, I don't have a camera, and I also don't have that rotating tripod. I must buy it. So the medicine that they gave me when I got there, they gave me 2 bottles of this medicine that I must take every 30 minutes, starting from 9 o'clock and 9:30, 10, 10:30, 11, up until 11:30. And then the last one I took after 12. I was supposed to take it at 12, but then it was full, and then they were running low on the schedule. I mean, I was supposed to be in there by 12, but they were busy with other patients, so I got in 12:30. That is when I took the last part of that solution. So that medicine barre, it makes your intestines white. It makes your intestines white for the CT scan, so that when you go under the machine and then your intestines are white, and any other object that is not supposed to be there, like tumors, cancers and everything, then they have their own color. So that's how the girl explained it to me. So I took that up until 11:30, and then I went in and then I did the scan, and then I have the results here. These are my, the results. These are the images that they were taking. So I get, if ever you go for an x-ray, they give you the images plus the report that explains what are the images saying. So now they say that for this test, it's it's detailed, the report is detailed, and it takes days, unless if ever Dr. Shiva wrote there that it's very urgent, like he wrote with the bone scan. He wrote on the referral letter that it was very urgent, and that is why I got the appointment yesterday, and the results will be ready tomorrow. Understand? But I will not be going back to Dr. Shiva up until I get today's results, And then, like he said on Monday, that he needs both this test in order to determine the treatment that I'm supposed to start. So I'm supposed to be, he suggests that, let me put it this way, he is suggesting that I start with the oral treatment, that tablets that and then for a couple of weeks, I think, or a couple of months, while we're shrinking this breast. Because as you can see, I don't know if ever you'll be able to see this one. You see, it's hard. You can't even do anything. It's hard. It's very painful. The nipple here, it's getting sucked inside, and then this one still looks normal, but then it's not normal. And then here is the lump. The lump is here, and then the nipple still, this one still looks okay. It still looks okay, but then this one is already damaged. It's very painful. Yesterday I had Kijile poloni, and then that poloni is starting to um have a reaction here. I'm not supposed to eat processed meat, body poloni, body Russian, Vienna, liver spread, things like that, things that are processed meats and raw meat. I'm not supposed to be having that. So yesterday karagama guinya nakapapa. I bought magunya gift us betlele, and then poloni. And then that poloni, it will no affect here. You won't be able to see. So here it is swollen here, and then it is reacting to that. So this one, it is the one that they're going to cut. They're going to cut this breast. They're going to remove it altogether, and then this one, they're going to remove this lump before it gets big, because now it's growing every day. So the treatment that he said he's suggesting that I start with will soften this breast, so that the operation is easier, and will also shrink this lump also, and then so that they will be able to remove the lump, so that I can still have this breast, but then I'm not going to have this one. And then he said that he will refer me to the plastic surgeon in order to reconstruct my breast. But that's if medical aid is gonna pay for that. If medical aid is not paying, I'm not worried. It's not like I care that I'm gonna have breasts again. The only thing that I feel and I think that is going to stress me out is relationships. I was telling my friend earlier today that I don't want the relationship anymore, because I don't know if ever I'm going to have the confidence to be naked in front of someone, you know. I'm sorry about that. I had to stop recording. So I was saying that I don't want the relationships. If this thing I heard it while I was in a relationship with someone. I was married or in a committed relationship, and then that person was supportive. Yeah, maybe I was going to continue with that relationship, but I don't want to start a new relationship and then having to be naked in front of someone and having to explain why I've got one breast or why I don't have both breasts, because the surgeon that I saw, he said that he was going to remove both the breasts, but the oncology says that we're only going to remove one. So I don't want to explain all of that to a new person. I feel like what I'm doing now is already I'm already exposing myself, you know. So yeah, that's what happened. Even if I show you this result, you're not gonna understand them the same way that I myself also do not understand them, you know. Maybe if ever there was a report inside, like the mammogram, I got the report and the ultrasound, I was able to Google some of the words that I didn't understand. So this is basically how it looks like. So this is how the images look like. I don't even know what is this, because code. I don't understand what is what. So I will wait for the report. I will wait for the report and then for Dr. Shiva to explain all of these things to me. So this is how they look like. The images. This is how the images. This is how the images look like. The CT scan. This is how it looks like. So yeah, that's the 2 days that I had. I'm tired, I'm exhausted. I did up and down after from the hospital. I did up and down with my friend. We were looking for food the whole of Secunda, because when you get here, the food doesn't look nice. We leave, you go there, we leave, you go there. We ended up ranking like chicken dust ranking, and then I came home. And also another thing, remember the medication that I'm taking, my back is very far, but then I showed you in one of the previous videos over the weekend, the medication that I'm taking, it is causing me constipation. So that is another thing that I'm not feeling okay right now, because I'm constipated and I'm tired. I want to sleep, so I don't want to take the laxatives. In case the laxatives now, by my 1 2 I'll be awake, and tomorrow I'm going to work, and then I've got a lot of work to do tomorrow. So I don't want to go to work exhausted, so I'm not gonna take that. I would rather take it tomorrow morning and then get that up and down near toilet at work, rather than not having a good night rest tonight. So that's it. I'm going to sleep now. I'm going to sleep now. But then malakal, I did Google. So I don't know if ever maybe I should just make a cup of tea. Marenganate is when I activate the stomach. So I don't know, or let me just have water and then try to sleep. If I can't sleep because of the constipation, then I will have to take those laxatives. You know, because I'm trying to eat fiber as much as I can. Yeah, you go watch. I'm gonna cook mutepano. I'm gonna cook soft porridge. Then I soft porridge mutepa wa mabele. I'm gonna cook it now, then I will eat it tomorrow, because tomorrow morning I'm not gonna have time to cook it tomorrow morning. So I'm gonna cook it now and then take it as my lunch, and then I will eat it tomorrow, so that I don't eat maroto, dilo mamang, And today I had pap. Which was not cooked well. You know, people around here, they don't know how to cook pap like we do. I'm sorry to say this, but they don't. So the pap that we had today is gonna contribute to the constipation. So yeah, have a good night, guys. Oh, another thing. On Monday, they took my blood pressure and my thingy. They took blood pressure and weight and height and everything when I was opening the file there by the oncology, and I have lost weight. That's another thing that is stressing me. I have lost weight, a lot of weight, more than 10 kg. I have lost more than 10 kgs, and by that time, I mean, I'm not in a diet. I'm not on a diet. I'm not like trying to lose weight or anything, but I lost a lot of weight. Even my friend, because the last time I saw her was last year, when she saw me on Monday, because she came with me to the doctor. When she saw me, she was like, "You have lost weight." So I don't know if ever the weight loss is because of stressing so much, or it is the cancer eating me up. I don't know, but I have lost a lot of weight, more than 10. Or it's because I've stopped eating sugar altogether. Because I sometimes do eat sugar in my cup, in my tea, in my oats, but then I'll just have like one teaspoon, just so that it's not like but I have lost weight. I've lost weight. My work pants, they are falling. Ew. Yeah, I know. Anyway, it's fine. Thanks for watching, and please subscribe and tell your friends and your family and your colleagues to subscribe, guys. I need every little money I can get. So I need like 1,000 subscribers so that YouTube can start paying me. Actually, we all know that TikTok doesn't pay us. That is why I don't like posting much on TikTok, because it's pointless. So I need more subscribers. Please, guys, I'm begging. Tell your people to subscribe, and engage. Because if you comment, I'm gonna comment back. If you like, I appreciate it. So please, guys, subscribe. Thanks for watching. Saturday I'm going to do my hair, go lower the small lines again, in case Barry I need to go for surgery, because my plan was, if the doctor tells me that I'm going to start chemo, then I will cut my hair. But because I'm still doing more tests and still waiting, and there's a possibility of going for the operation first. So I think, and I'm still going to work, every day. So I'm going to do the small lines, so that if I go to the hospital, my hair is still presentable. It's not like, so yeah, I get to look at the hairstyle, did crazy, no, I'm just gonna do simple lines that goes to the back, like simple hairstyle. I got this days banyana ba my channel ke bare ke di wig lines, so I'm gonna do the wig lines, but then I'm not gonna put on a wig on top, Anyway, have a good evening. Mama, take a Thursday. I forgot to tell you the date today. So today is Thursday, 27 Feb. Tomorrow is month end. Stress is a month end. Maybe Laura, that is why it's not energy.
Forever, I'm loving this moment. Can we stay here forever? I'm loving this moment.
I will post again when I go back to the oncology. Peace out.